Okay, good morning, everyone. This is Jeff Carlson from Alliance Institute. Welcome to everyone on the webinar today. We're excited to have you with us. Our very special guests today are the National Association of Community Health Centers, and we're so happy to have them on board as well. Again, as I've said a couple minutes ago, this is a broadcast-only webinar generally, so if you have questions throughout the presentation, please feel free to chat them in the bottom right corner of your screen. For right now, everyone is going to be muted. If we decide we want to open up the phone line so folks can talk directly, we may do that. But for the main part of the presentation today, we want to sort of keep everything pretty quiet so everything can be conveyed clearly and appropriately. So I want to go ahead and get started. So today, our presenters, I'm sort of filling in for Stephen Bradbury. We had some technical problems getting him on board. He's the Executive Director of Alliance Institute. Kelly Dorsey is going to be the moderator. She's our Community Engagement Specialist here at Alliance Institute. Amanda Piers-Kelly is Director of Advocacy and Civic Engagement, and Abigail Pinkley is Deputy Director of Federal Affairs for the National Association of Community Health Centers. They're both working very hard on this issue around the primary care funding cliff. And it really is an important issue for folks not only along the Gulf Coast, but throughout the country. I want to talk real quickly about Alliance Institute and our mission. We're a 501c3 organization based out of New Orleans. We do work across the Gulf Coast in Louisiana, Mississippi, Alabama, and Florida. We provide community organizing training and technical assistance to nonprofits and community-based organizations throughout our region. Our primary goal generally is increasing economic and social justice through community engagement, and we are really excited to be working with NAC on this call. This is such an important issue. We're going to move forward to the next slide. So this is just a little bit more about what we do in terms of expanding community involvement. We fund community-based organizations. We do capacity building. We provide technical assistance and training. Strategic partnerships are also really important for our work, and we also do a lot of in the region. Increased access to healthcare is actually one of our main projects right now, and that involves a number of different areas, including community involvement, language and literacy access, preserving healthcare funding, regional healthcare services, as well as the Gulf Health Outreach Program. I actually want to talk about that just for a second. So the Gulf Region Health Outreach Program is a 5-year program to strengthen the healthcare, health literacy, and resiliency of Gulf Coast communities affected by the BP oil drilling disaster. This program was founded or created with the work of Alliance Institute back starting in 2010. So you can see from the chart here on the right that community engagement is the role that Alliance plays in this Gulf program, and it's about expanding healthcare access in the region. So what I want to do next is talk about our moderator, Kelly. So Kelly is going to be the moderator for the rest of the presentation today. I want to go ahead and bring her on board here as well to have her introduce herself, and then we're going to go ahead and move into NAC's presentation. Kelly?
Thank you, Jeff. My name is Kelly Dorsey. I'm the Community Engagement Specialist working across the Gulf Coast with Alliance Institute, and I think that we're about to begin with Abigail Pinkley, and who is the Deputy Director of Federal Affairs at the National Association of Community Health Centers, and then go into Amanda Pierce-Kelly, who is the Director of Advocacy and Civic Engagement at the National Association of Community Health Centers. So do you all want to begin? If you have, just one more thing, if you have any questions, just please type them below, and you can ask questions throughout their presentation, and they'll answer them along the way. We will also have a question and answer session at the very end.
Nice introduction. I appreciate it. And actually, we're going to switch things up a little bit. I'm going to go ahead and get started, and then I will turn everything over to Abby to have a discussion about the sort of the policy side of what we're talking about when it comes to the primary care cliff. And then when we switch gears back to advocacy, which is my favorite thing to talk about, obviously, Abby will turn it back over to me, and then I will hand it back to Kelly. So just in the way of, who are we at NAC? I know many of you on the line may be directly involved with, working at, or somehow affiliated with health centers, but just a little bit of context. I wanted to start out with, what's the history of health centers? What do we do at NAC? And what makes health centers a little bit unique, just as a refresher. The story of health centers goes back a long time. We're actually just about to kick off our 50th anniversary in 2015. But really, the concept and the program started as part of the war on poverty. And the first two health centers began in Boston, Massachusetts, and Mount Bayou, Mississippi, near and dear to many of you, I know, down in the Mississippi area. But there was a recognition of the fact that really we needed to be doing a better job to make sure that there was equal access to healthcare, and there were just so many folks that were disenfranchised and didn't have a place to go for a variety of reasons, some of them racial, some of them geographic. There just was no access to healthcare at that time, and so Count Gibson and Dr. Jack Geiger put their heads together and actually taking a model that they became aware of in South Africa, they brought it back to the U.S. and they started the first two health centers, as I said, in Massachusetts and Mississippi. And it was officially funded as a health center program under Section 330 of the Public Health Service Act shortly thereafter. So it's a long, rich history. I think when we talk about health centers, it's really important to recognize what makes them unique in terms of primary care providers. We are the only program in the country, we're the only healthcare delivery system that maintains a 51% consumer majority board, patient majority. The reason for that is to ensure that the true needs of the community are being met and represented and cared for. It's simple for somebody to sit behind a desk in Washington and try to make a determination about, what guidelines everyone needs to follow around the country. That's all fine and good, but the reality is the folks on the ground that are actually using the services and understand what's going on in the community are in a much better position to be able to drive the development of the healthcare programming that we put together. And so, for example, there may be a community that really has a need for greater mental health and behavioral health services. And so the health center model enables that board, that consumer majority board, to design some of their programming, understanding the specific unique needs of that community, and that is something unique to health centers. A couple of other components that make us a little bit unique in terms of the health center world is that we have to and always do provide health care to anyone and everyone, regardless of their ability to pay, status, insurance status, and so forth. Anyone who comes through the door, we are required by law and as part of our mission to make sure that they have good access and quality care. And the other thing is that some of you may have heard this expression, but health centers tend to be sort of one-stop shopping for primary care, meaning that part of our model is to make sure that when we think about access, we're looking at the big picture. And so whether it be primary care, behavioral health services, dental, sometimes podiatry, really whatever our patients in our community needs, that they can get those services under one roof, with the understanding that, quite frankly, it's challenging to go to multiple places to get some of these services, particularly when you take into consideration so many of our patients are, it's a struggle just to get to these appointments. And so we try to, as part of our model, make sure that access goes beyond just having a place to go, and meaning that you can access all of these things under one roof. And just to pause, and so folks understand what we do at the National Association, we were incorporated or organized in 1971, and we work with a network of state health centers, primary care associations, and partners in a variety of ways. But primarily, we're driven by research-based advocacy for health centers and the clients that they serve, all of their patients. Part of our goal is to educate the public about the mission and the value of health centers. We provide training and technical assistance to health center staff and boards, and quite frankly, with our partners and around the country, to make sure that there's a good understanding, again, of the health center program, the uniqueness and the values that they bring to our healthcare system. And as an organization, we also work always to develop alliances with private partners and key stakeholders to foster the delivery of primary care services to communities in need. So with that, I think we will go ahead and jump into the policy side. We're going to talk today, obviously, about the primary care cliffs, and I want to turn it over to Abby. So let me go ahead and do that. Abby, you should have control of the screen, and you should be off mute. Are you there?
Hi, I think I'm here.
Perfect.
All right. So I want to talk a little bit today, just give a broad overview about what is generally happening up on the Hill and how health centers have fit into that model, and how we are funded and what we are facing regarding the primary care funding cliff. So all you have to do is pick up a newspaper today, listen to the news, and you generally get the idea that the environment on Capitol Hill is not good. In fact, it's pretty depressing. And, it's been one of the least productive Congresses in history, and not much has been accomplished in the past few years on the Hill. And unfortunately, a lot of that had to do with election cycles. A lot of that is related to bad feelings over the passage of the ACA, but either or, unfortunately, the situation that we're in right now on the Hill is there's a lot of gridlock, and unfortunately, bills are usually only passed when there is a looming crisis, or when there is a crisis and Congress needs to act immediately. There hasn't been a whole lot of proactive passing of legislation to address issues. There haven't been large comprehensive packages passed on the Hill. It's been very much a lurching towards the next crisis or next funding crisis situation. Probably the best example of this is what just happened, where the government narrowly averted a shutdown over this past weekend. They funded, finally, very tardy, I would add, funded the government through the next fiscal year. So, it's an odd environment on the Hill, and not one that has been in the past. And unfortunately, a lot of this is related to, at least on the funding side, the fact that Congress is acting under what is called the era of austerity, where the federal government no longer has a blank check to spend. They have to operate within what are known as budget caps, and they have to balance the budget based upon the parameters that they set every year for how much money they can spend. And that has led to a lot of issues in Congress on how they prioritize the funding for various programs that members champion. And it's been a difficult process for Congress to pass bills, particularly funding bills, because they're having to make very difficult decisions each fiscal year. I'm going to move this ahead. Well, okay. So I'm having a bit of problem moving this ahead.
It should be on the environment side. Up at the top there, Abby, there should be an arrow. But I have it on the environment. Do you want it to go forward again?
Yeah, can you move it forward? Oh, okay, Here we go. Yeah. Sorry. For some reason, I'm not able to move it forward.
Okay, well, just let me know and I'll keep advancing for you.
Can you advance for me?
Yep. Is it working?
No.
Jeff, I'm not sure if you can jump on and help us here. She has the globe, so she should be able to advance it, but maybe let me try this.
Better?
Abby, which slide would you like to be up, and maybe Jeff can help us?
The good.
Yeah, okay. So it should be slide 6, Jeff?
Oh, yeah. Okay. Hang tight. That one?
One more.
Lord, yeah, this is acting kind of funny on the webinar side. So the health center funding streams, is that correct?
It should be a light blue slide that says the environment, the good.
Right.
There
There it
we
is.
go. Okay. Sorry, everyone, technical difficulties. But one of the good things about the health center program, even in this terrible environment that we have going on in the Hill, is that we have strong bipartisan support for our program. We have a lot of members who understand the value of health centers and the model and the mission and what we do in their, specifically in their congressional districts and in their communities. And, you know, in this time when members are looking to, you know, increase the value of services and care in the healthcare sector with a very limited pot of money, a lot of folks are looking towards health centers as a solution to that, given the cost-effective model of care that health centers have. You know, health centers annually save the healthcare system approximately $24 billion. And, you know, when members are looking for an effective solution to some of the problems that our healthcare sector is facing, oftentimes health centers are coming up in that conversation. So even though this environment is terrible, we've been very fortunate to be on the end of a lot of positive conversations about, you know, what could happen and changes that could happen in the healthcare sector. So, how are health centers funded? We have two streams of funding, and one stream is what is called the discretionary stream of funding. That is what Congress passes every year through what is known as the appropriations process. That is when Congress hears from their constituents on what are priority programs that should be funded, and members put in their submissions for how to fund programs, and then they come together and draft a piece of legislation to fund healthcare programs or other various programs, but then they pass what is called a fiscal spending bill or an appropriation spending bill. And usually they take those submissions in March of the prior funding year. So for example, we were just working on the fiscal year 15 appropriation spending bill, and that big government spending bill that passed this weekend was fiscal year 15. The government was working on that, and the Congress was working on that in the year 2014. So the government is always working on the next fiscal spending year. So when this slide here at the bottom says currently fiscal year 14, we actually this weekend have passed the current fiscal year 15. So we're actually going to be a little bit ahead. Typically, Congress is forced to pass their spending bills by September 30th. So actually, Congress was supposed to have passed their fiscal year 15 spending bill by September 30th of 2014. They passed a series of short-term extensions and actually didn't complete the fiscal year 15 appropriations process until this weekend, which is very tardy. That typically doesn't happen, but in this era of bad blood on the Hill, it's been a very delayed process each year, and actually Congress has typically relied on a series of short-term funding extensions just to keep the government open. What is really great about what happened this last weekend is that Congress was able to complete their fiscal year 15 appropriations process and fund the government for a full year, which is something that has been hard to come by, which is really good for us and for a lot of other programs because, as you all know, if you're running a business like a health center, you know, you need that stability in funding to know that you're going to be able to make payroll, that you're going to be able to provide that care. So we're very pleased that Congress was able to pass that full year spending bill. So what does that mean, and what was included in that spending bill for health centers was the same amount that was provided for health centers on the discretionary side in fiscal year 14. So for fiscal year 15, health centers on the discretionary side were funded at $1.5 billion. You'll see on this slide under this discretionary spigot that in 2011, Congress actually cut our funding on the discretionary side by $600 million. And unfortunately, we've been relying on our other stream to make sure that health centers didn't feel the impact of that discretionary funding reduction. And that gets me into the other way that health centers receive funding. We receive a dedicated pot of funding through the Affordable Care Act known as the Health Center Fund. This was a 5-year pot of funding. It was a mandatory pot of funding, which means Congress does not have to act. That funding was set aside by Congress. It was over at the Department of Health and Human Resources. And each year, on that date that I previously mentioned, September 30th of each year, from 2011 to 2015, that funding is triggered and it goes out to health centers, or it's available to health centers, I should say. That funding is available for the Department of Health and Human Services to spend on the health center program. And so that current funding stream in 2014, that current funding level that we got through the mandatory side was $2.2 billion. In 2015, that funding stream through the mandatory funding is $3.6 billion. So between 2014 and 2015, the health center program will have access to $1.4 billion in additional funding under the Affordable Care Act. However, that mandatory funding stream that we've been relying on for the past 5 years is going to expire in 2016. And when that happens, the program will be facing a 70% reduction in funding. So that is how we get into what is known as the health center funding cliff. So this chart here on this slide should help illustrate the breakdown in funding and how it has occurred. So as you can see, prior to 2011, health centers relied solely on that light blue stream of funding, which is the discretionary funding, which, as I mentioned, is the funding stream that Congress decides on every year. And you can see in 2011, that light blue stream has gone down. That was when Congress cut that funding, that discretionary funding, by $600 million. But you can also see that dark blue line, which is where we started receiving the mandatory funding stream under the Affordable Care Act. So each year that has gone up, and every single increase in funding that the health center program has received has been through the Affordable Care Act funding through the Health Center Fund. And as you can see, as we enter into fiscal year 2015, we are receiving the largest increase in funding for that $3.6 billion in funding under the Affordable Care Act. I should go back and say, in case folks are wondering, that light blue $250 million in funding in 2015 was the funding that a lot of health centers received under the ARA program. So that was one-time funding and has gone out the door. So as folks look forward into 2016, you can see on this chart, it's obviously a dire situation that health centers are looking at. Unless Congress acts, we will no longer have access to that mandatory funding stream, and the program will go down to levels that we haven't experienced in over 5 years. Those levels will take us back basically to funding levels that the program was receiving in 2008. And that is not a circumstance that health centers want to be in, and unfortunately would mean that a lot of health centers will have to close their doors. They'll have to lay off staff, and it will not be very good for the communities and the patients who rely on those health centers. I should also mention that there are 2 other programs that also receive mandatory funding stream that are scheduled to end at the same time as health centers, and that would be the National Health Service Corps, which helps health centers recruit providers to work in their health centers through scholarships and loan repayment. And then also the Teaching Health Center program, which is a community-based residency training program that health centers have been able to access in order to grow our own providers. So yes, here it is. The National Health Service Corps is eligible for $310 million in funding in 2015, and unfortunately in 2016, the National Health Service Corps will be receiving $0 in funding and would cease to exist in 2016 unless Congress acts, and the Teaching Health Center program is unfortunately in the same boat. So it's a very dire situation for all three of these programs, which we call the health center, or the primary care funding cliff, So what are the key points that we put forward to folks on the Hill, and especially to health centers, as to how to talk about this issue with their members of Congress and even folks within their community, to let them know that this is a problem and that this is actually something that will impact their communities. And, you know, a lot of times it's hard for folks to understand that something so complicated as the mandatory and discretionary funding streams, it's hard for folks on the ground to, you know, kind of comprehend and grasp that this is a real thing. You know, a lot of folks think, oh, you know, Congress will take care of that. That's not really going to impact us. But unfortunately, as you all saw on the slide that I presented with the graph, you know, this is a real problem. This impending cut is real unless Congress acts. And, you know, health centers will have to raise the drumbeat, and, you know, it's not just going to be health centers that are going to have to do this, but we're going to have to heavily rely on our community partners to put forward what the impact would be if health centers are actually closing in their community and how that would impact them. You know, so we've asked our health centers to estimate what a 70% reduction in funding would mean. If that cut were to go forward, how would that impact your community? How many folks would you have to lay off? Would you have to shut down sites? We want to translate to the Hill just what the actual impact of this will be. Not only that, but, you know, a lot of programs are in the same boat as health centers. It's been a very hard year and hard several years for a lot of programs under this era of austerity, where Congress is really focused on cutting funding and not growing funding for programs. And we're one of many programs who are talking to the Hill about how we need increased funding. And we believe it's really important to break through all of that noise that the Congress is hearing and actually, you know, lay out what those true impacts will be and how it will impact everyone in their districts and in their states. So this is just part of, you know, raising the drumbeat on how to ask for a fix. We know this is going to be a long slog, but if Congress doesn't fix this by September 30th, 2015, we will actually feel the impact of a reduction in funding for health centers. So we're working to mobilize folks now. We have a great set of resources which can be accessed on this resource library that we have, but I think Amanda's going to talk more about how we can utilize folks on the advocacy side. So with that, I'm going to turn it over to Amanda.
Thanks, Debbie. And I don't know if I can advance the slides now because you still have, yep, okay, she took care of it. We're getting a handle on the technology here. So, you know, I think a lot of what Abby spoke to, it is obviously this is a health center and primary care specific issue. The National Health Service Corps, just for folks on the phone who may not be super familiar, is a program that is extremely important to the health center program, but to individual health centers as a tool to help with recruiting providers. Obviously, it's a loan repayment program, but it also drives folks into primary care, which I'm sure it's not news to folks that there's a huge shortage of providers in primary care. So the fact that it's not just the health center program that's facing this catastrophic reduction in funding, quite frankly, but also these other programs that support health centers and enable them to be successful in providing care in their community to their patients is that much more damaging. And so it really, when we talk about the primary care cliff, it's bigger than health centers, of course, and we really have been doing everything we can since, I'd say, essentially the start of 2014 to engage the health center network and as many of our partners and stakeholders in this as we possibly can. Part of what we did to start is to launch the Access is the Answer campaign. This was something we did in February of 2014 to organize every health center advocate and all of our stakeholders and our partners to get Congress to take action to fix the health center funding cliff. And really the goal of the campaign, the Access is the Answer campaign, is to demonstrate that there's just an absolute outpouring of support in our local communities for health centers. And quite frankly, that's why working with so many of you who are on the webinar today with our partners is so critical to our effort to make sure that there's action to fix the cliff. So just as a reminder, and when it comes to health centers specifically, when we talk about advocacy, it's really important to remember that our patients often really do not have a voice in these issues at all. They are, quite frankly, more concerned about making sure that they're getting food on the table for their kids and clothes on their backs than they are picking up the phone and talking with their member of Congress. And the unfortunate side to this is that a lot of the policy decisions and determinations about how resources are allocated have a very direct impact on them. So when we talk about advocacy and health centers, it's in recognition of the fact that if we don't do this, who else is going to provide a voice to the more than 22 million patients health centers are serving currently? Some other things to bear in mind when we talk specifically about the health center funding cliff is that it's not just a matter of, okay, you know, patients are going to lose access to care. It's also there are health centers who may have to close their doors. There are health centers that may have to lay off staff. There are health centers as a result of this reduction in funding that will really have to look at changing the hours of operation. And you take that a step further, and again, you know, the way that I would like for those of you who are not necessarily working at health centers or directly at health centers to bear in mind that there's a ripple effect of this across the entire community, and Abby spoke to this to some degree. But when you talk about closing doors, laying off staff, you know, basically just fewer resources to keep the operation going in the way that it has been, that spreads across the entire community and has a very direct impact on local economy. And even for the patients, and more importantly, quite frankly, for patients who are losing access to care, we all know what happens when that scenario takes effect. It means people are going a longer period of time without any access to care, which means they are likely to become even more sick. They are very likely to end up in emergency rooms where the cost of care is, you know, astronomical, and probably by the time they arrive at the emergency room, the complexity of their healthcare issues are that much worse. And these things, again, spread across the entire community. It's passed to everybody, not to mention the human impact of this, that, you know, part of our mission at the health center level is to empower our patients to be able to live healthy, successful, quality lives. And so it's bigger than just, you know, we need more dollars to make sure we can keep the doors open, which is obviously a key factor. But we all really need to continue working together to make sure that the needs of the community are being met and that folks can continue to be healthy and high-functioning members of our local communities and societies. So again, taking this back to the Access is the Answer campaign, and what we are asking folks to do right now as part of the campaign, we have established over a period of time several action steps. We started out back in February with 3 specific action steps, one of which was an Access is the Answer petition, and the second of which was the collection of local support letters. And this is a really important action step for those of you that are partner organizations with health centers and stakeholders. And for those of you that are health centers on the line now, this is an activity that I really encourage you, if you have not started this collection effort, to get started. What we're trying to do with these local support letters is to convey to our members of Congress why it is so important that they prioritize the issue of fixing this cliff and take action to do so. But it's not enough to just say, this is important to the health center community. I wish that were enough. part of what we need to do is to convey to Congress that the entire community is behind this, and that our stakeholders, our partners, our local elected officials all recognize the vital role that the health centers play in the community, sufficient that they are now getting involved and raising their voice on behalf of and in support of health centers. So these local support letters should be submitted by our partner organizations, our local elected officials, and so forth, directly to members of Congress on behalf of the health center. So if you are a partner on the line, if you are a university or another not-for-profit, and you work with the health center in the community, I would encourage you to have this discussion with them. Mention to them, I know one of the things that you're trying to do is gather these local support letters and submit them to the congressional delegation. We would really like to be able to do that. If you are a health center on the line, you should think about creating a list of folks, your partners, your local elected officials, your stakeholders, and approaching them to see if they would be willing to submit a letter of local support to your members of Congress. As part of the campaign, we have really tried hard to make sure that we create template materials to make this process and this collection effort as easy as possible. They are designed for health centers to take to these partners and stakeholders, but certainly for those of you on the line that are in the partner category or the stakeholder category, or maybe even the local elected official category, if we can be helpful in creating materials that you would find useful in this effort, we're happy to do that. There's contact information at the end of the presentation, so please feel free to reach out. But the point is, we need for the voices on behalf of health centers to take a wide range and really to represent all of the different diverse sets of interest in the community and why it is so important to everyone across the board to make sure that this issue is addressed. And the second action step as part of the campaign that we're in the midst of right now is the submission of local media pieces. And I'm sure this is not going to come as a surprise to many of you, but our elected officials pay a whole lot of attention to the issues that come up in local media. And so by placing local media pieces, either letters to the editor or opinion editorials about, again, not just what the primary care funding cliff looks like, but also the important role that health centers play across the community and the ripple effect that this will have should action not be taken beyond just the patients and on-site at that health center. Getting that out publicly in local media is a very effective way to educate the community at large about what's at stake, to get the attention of our congressional members, which we need to do since they are those that need to take the action. And again, I think it just showcases how everyone needs to be working together on these issues. And again, this is an area where we really have worked hard to create template materials to make it as easy as possible and step-by-step guides to how you can submit those letters. And again, the templates currently are designed with health centers in mind to be able to submit on their own behalf. But for those of you that may belong to a different category, be it partner, stakeholder, or otherwise, if you are interested in submitting such a letter or opinion editorial, we would be happy to work with you to look at what kind of language we can create to support that effort. But in terms of ongoing and what this campaign will look like, you will see coming up after the first of the year a refreshed set of action steps and ways in which folks can continue to engage to raise the drumbeat, as Abby said, on what we can be doing to make sure that there's action to fix the cliff. This is just to give you guys the direct links to the resources that I mentioned. We've also created flyers and note cards, and for folks that are active on social media, we've tried to create samples and images so that you can get the information out in that respect. And on the policy side, again, this is somewhat driven to health centers, but in order to really paint the picture of what a 70% reduction in grant funds would look like, we have created items like the Cliff Estimator tool, where a health center can actually go in and plug in their own local numbers relative to, revenues, patients, and so forth, and it will create a customized graphic that paints the picture of what that would look like on the ground. We do have primary care funding cliff graphs and charts that are somewhat specific, not necessarily to the local community, but certainly to your state, and in some cases by congressional district. We have talking points and frequently asked questions, and we really, again, have tried to make sure folks have access to as much information as possible around what this actually looks like. That being said, I just want to pause for a moment and say that a lot of the discussion when it comes to the primary care funding cliff tends to be around the dollars and the figures and the data, and those are really important pieces to the conversation. That being said, I think it is so critical and absolutely most important to talk about the human element of this. We're talking about people not being able to access care who, will be forced to go without and wind up in really difficult, challenging situations that they shouldn't have to find themselves in. And so while I think it's very important to speak to, this is a several $1 million reduction to my bottom line, or this is, staff layoffs, which also has a human element. I think it is very, very critical that we talk about what this actually means for people, which is the most important factor here. So a couple of other things that folks can do just in terms of staying engaged and getting involved in our advocacy efforts. You can join the Campaign for America's Health Centers, which will plug you into the Access is the Answer campaign, which is obviously specific to this health center and primary care funding cliff. The things that you will receive as a part of joining is a weekly update about what's happening in Washington, what issues are most pertinent to health centers and otherwise. When there is need to act, you will receive calls to action. We try very hard to make sure that we provide materials in Spanish as much as possible. We do occasionally host national teletown halls or teleforums where folks can get updates about what's going on around the country relative to health centers, but also ask their questions directly. And then again, it plugs you into a platform that enables you to send information and messages directly to your members of Congress. So it's an easy way to stay up to speed on, what's happening with this issue and certainly what you can be doing to take action. So, this last slide here sounds a little dramatic, but I have to be honest. I joined NAC in 2005, and certainly in my almost 10 years working with health centers, I have never seen a challenge anything close to this facing the program. And quite frankly, my colleagues, many of whom have been around since the walls went up, so to speak, would also tell you that this is a challenge that health centers have never faced before. And so I think when we talk about what needs to happen and the action we need Congress to take, it has to do with folks like everybody on the line today taking action and making a concerted decision to commit to engaging. Advocacy really requires action. It's not enough to just sign up and get the information. It really does mean making a commitment personally and at your organization to taking these action steps to ensure that there is congressional action to fix this issue. And the bottom line is that our advocacy, the strength of our network, and the relationship we have with our stakeholders and our partners, all of these things combined and the action that comes as a result is going to determine the future of the program and the strength of our advocacy. So with that, I will leave our contact information up there, and I think I will turn it over to Kelly, I think. There was one question that I saw come in, the difference between CHCs and FQHCs. There isn't a difference. Federally Qualified Health Center is the policy name for health centers that belong under the 330 section of the Public Health Service Act. So once they have become qualified and they are receiving a grant under that Section 330, they are a community health center, they might be a migrant health center, they could be a homeless health center, but they are all grantees under that Section 330 law, and they are qualified, federally qualified health centers. But you'll hear those terms, that acronym, used interchangeably, but they're really, the important thing is if you see or hear someone talking about a CHC, if there's any question, you can double check to make sure that they are in fact a federally qualified health center. But I would say within the health center community, we interchange the two quite frequently, and there really isn't any difference. So Kelly, I'll turn it over to you. I'm not sure if there were any other questions that came out, but happy to respond if so.
Thank you, Amanda. Did anybody have any questions? If so, type them below in the right-hand box in the question and answer section. You want to ask your question? So I have one question here. How do we convince community-based organizations that are not directly involved in the healthcare to participate in this issue? So basically, Amanda, have you engaged different partners who are not involved in healthcare, and what did you move?
Sure. Yep. I think it's a great question. And actually, I think that folks that are not necessarily in the healthcare spectrum have a really important role to play in this. We do see all walks of the world getting involved in this issue, from, the faith community, churches in the community. We've seen chambers of commerce. We've certainly seen local and state and county elected officials, opinion leaders, really all over the place. I think the reality is, and the way that I would approach it, is to start with a conversation about what the health center does in the community and the value that they bring to the community, and what would happen if they weren't there anymore, or if they, if their operation were really severely changed as a result to these kinds of funding reductions, and what effects that would have. I think one of the easiest and most direct ways that other organizations and individuals can get involved in this issue is by submitting those local support letters. The letter really does and is meant to paint the picture of those things we just talked about, the value that the health center is bringing to the community and what's at stake if Congress fails to act. But then to say, listen, for example, I don't even work in the healthcare sector, and even I can see that this is an unacceptable outcome should Congress fail to act for all of these reasons. These are the impacts that it's going to have, and I feel strongly enough that I'm willing to step up and ask that you make this fixing the cliff a priority. And so I would start probably with those letters. There are events that health centers hold frequently. We ask them to host elected officials, specifically members of Congress, often. I think being present at some of those events, and where it makes sense, potentially attending a visit with a member of Congress to be able to reinforce the need for swift action on this. These are some of the things that I think folks can do if they do not necessarily operate in the healthcare sector. But I would also say just signing up and joining the campaign and becoming a health center advocate and being able to send your message, using our platform even, or picking up the phone when the call comes in. There are times when the most effective advocacy is direct and one-on-one, and it's relationship-based, and it's a clear, distinct message. And there are other times where it's a numbers game, and part of what we need to do is just turn up the volume and make sure that this issue is recognized and prioritized among so many other issues that Congress is being asked to address at the same time. And so participating as an advocate and joining that network also helps on that side of things when it's a matter of numbers and we just need to turn out the number of messages and points of contact. So there's a variety of ways, but if there are specific questions, feel free to email me after the webinar, and I'm happy to talk with you about what you specifically or your organization specifically could do to help.
Okay, I have another question here, Amanda. How can we, as a FQHC, get the word out to our patients, vendors, and our community to see the need in Congress acting in order to continue to help with our underserved, in our communities?
It's a great question. So I think that a lot of the resources that we went through in the, I think it was 2 slides back, we do have a lot of resources available to explain this issue of the primary care funding cliff on our campaign site. It's www.saveourchcs.org, and there's an entire section dedicated just to the CLIF. And that ranges. You know, a lot of the materials that you'll find on there are linked or created with the purpose of educating patients. So you'll see flyers, you'll see one-pagers, you'll see translated materials. I think that absolutely the other thing that folks should be doing at the health center level in order to help educate about this is taking advantage of those CLIF-specific tools, and that address is www.nac.org/CLIF. The CLIF estimator tool, truly, it's customized to your health center, and it puts together a graphic specific to your community that shows exactly what the CLIF would look like, how many patients would lose access to care, what the dollars lost would be. And I think looking at that graphic and then translating it again to what that ripple effect across the community would look like is part of what you need in your toolbox to have those conversations with vendors and others in the community. But I think, quite frankly, you know, if you know what your grant numbers are, you know, if you know what you're receiving in grant dollars, reduce it by 70% and just ballpark, you know, what does that look like? It's different for every single health center, but I've yet to run into a health center that it doesn't sting, you know, and unfortunately more often what I hear is there's no way we would be able to keep one of our sites open. You know, several thousand patients would lose access to care. We would not be able to hire X provider. We would be looking at having to lay off such and such a number of staff. These are all real things that equate at the community level, and those are the conversations I would recommend having both with community partners and with vendors.
Thank you, Amanda. I have another question here. As an FQHC, are we allowed to advocate? Is this considered lobbying? We are concerned and want to help, but don't want to get in any trouble. Please clarify for me. Thanks. And that's from Joey.
It is also a great question, and in fact, we just hosted a webinar on this topic just a couple of weeks ago. So actually, all of the activities that we've been talking about today and all of what you will see on the campaign site does not technically fall under the definition of lobbying. It is all advocacy and education. Just to be clear, the only time that you're actually lobbying is when you're asking an elected official to take action on a specific piece of legislation. For example, if you're saying pass Senate Bill 101 or vote no on House Bill 2, that is considered lobbying because there is a specific piece of legislation that you're asking for a specific action on. That being said, health centers are actually allowed to lobby. Legally, you are allowed to lobby, even in those circumstances. The only restrictions when it comes to lobbying is that you cannot use grant dollars, federal grant dollars, to support those activities. And you need to be able to show how you have supported those activities when they have occurred, and that becomes more of a discussion about accounting. But the bottom line is all of the activities that we're talking about are well within legal guidelines. There's no issues whatsoever. Every health center can and should be engaging in this, and there's nothing preventing you legally to do so.
Thank you. And something that I want to mention is we're going to be working with Alliance for Justice and holding a series of webinars, but they're going to be talking about what clinics and community-based organizations can do under their 501c status around advocacy and lobbying. But then we're also partnering with HealthVote, one of NAC's partners, to have a webinar to talk about how clinics can incorporate advocacy, but also voting into their clinic services and registering patients to vote. So Sharon asked, please repeat the CHCs.org site. Was that it?
Yep, www.saveourchcs.org. And you'll see that's our Campaign for America's Health Centers website, and you'll see on that site there is an entire section dedicated just to the funding cliff. But you'll also see how you can very easily sign up to be an advocate and stay up to speed with all of our issues and access all of those great templates. But again, if anybody has questions, please feel free to email me after the webinar. I'm always happy to help, whether it's, coming up with something tailored and specific to your organization or your health center, or just sort of brainstorming about what you can do in your community.
Thank you. Jeff, do you want to move to the last slide? Okay, so I want to thank Amanda and Abigail for joining us today. For Alliance Institute, our next steps are we're going to be partnering with Louisiana Primary Care Association, Mississippi Primary Health Care Association, and Alabama Primary Health Care Association to hold state-based webinars on the primary cliff with NAC, and it will be state-specific. One of the things that Amanda mentioned earlier on the webinar is they've done a lot of work in looking at both what is the impact around jobs and also the impact on the community. So those webinars will be really specific to the states. The next thing is we are going to be partnering, as I said earlier, with Alliance for Justice, so community-based organizations and clinics know what they're allowed to do under their 501c status legally. And then the last follow-up, we to have a webinar with clinics on incorporating get out the vote and registering the vote into clinic services, but also how you can talk with your patients around what's happening around the funding cliff. So that's all from us. Amanda and Abigail, did you have anything else?
Just to say thank you very much, Kelly and Jeff and Candace and everybody at the Alliance, and to everybody who joined us today. The fact that you took the time to learn more about the funding cliff and have made it a priority today is